The world Sisulu University is known for producing world-class doctors through its faculty of medicine. And some of those doctors are struggling to find employment. Meanwhile, rural provinces are mostly affected by the shortage of doctors. This symposium seeks to find ways to address these issues.
What it looks at is a research unit really within the university that wants to look at the availability of health workers, the distribution of the health workers, and including the skills mix and geographically as well, if they are appropriately placed, and also the wellness and competence of those health workers. Really, more than anything, what we're seeking for is learning from how other people have done it, so that we don't actually repeat our mistakes if there are mistakes. We actually draw from lessons and see how we can do things differently to get better and improve the health system for everyone.
The World Health Organization believes the country still has a lot to do to improve its health system.
I think there's room to improve in terms of having more health workers, particularly if you take into account the fact that we are seeing about 19% of South African doctors who are more than 55 years. We're seeing more than almost 24% of South African nurses 55 years or more. That means there's a need for strategic planning to be able to replace them in a way that there will not be a gap in the kind of skills that are available at the country. One other thing is also that even when you look at the numbers in South Africa, they are not evenly distributed across the different provinces, and more rural provinces tend to have fewer health workers, and therefore the people would have more limited access to quality health services than the urban provinces.
Meanwhile, the National Department of Health believes the unemployment of doctors should not be singled out, as many industries face the similar issue. They say lack of funds are also a contributing factor.
However, what we are also raising is that it is just a question of now having to agree as a collective and stakeholders on how we can do things differently. Amongst the issues that we are raising for discussion is how can we improve on efficiencies, including where within the current financial expenditures can we find an opportunity to have some savings that can be used for employment. An example at hand is that of the review of the committed overtime, which is what we are engaging as stakeholders on. The second issue that we are raising is how can we then as a collective and stakeholders start discussing what we refer to as different employment models. We are aware that from a national perspective that Limpopo has implemented the issue of shift work, which we are reviewing and supporting, but we have also said we need to take lessons from their experience and see how can we better do it.
The National Department of Health says it will also consult other stakeholders, including labor unions, about their plans to create more opportunities for health workers. Lwandile Mbulali, Mthatha in the Eastern Cape.